Can you tell me about a time in clinicals at Fayetteville Technical Community College in which you delivered high-quality patient-centered care to individuals, families, groups, and/or communities in various healthcare settings?
During my labor and delivery rotation, I was assigned to take care of a client who was scheduled for a C-section. My role was to assist the nurse with prepping the client for the OR, and I was able to follow her case all the way through. During that time, I noticed that the client appeared very anxious and nervous, so I decided to just pull up a chair and sit next to her so I can talk to her and kind of get a better feeling of what was going on with her. She expressed to me that she was nervous about having the surgery in general, so I just talked with her, provided her with the distraction, let her tell me about her family, her kids at home, and when it was time for her to go back to the OR, she wasn't nervous anymore. Her anxiety had kind of resolved, and she was very appreciative that I took the time to sit next to her and just let her talk to someone to give her a distraction before her major surgery.
Why does this example meet the objective?
This example meets the objective because the therapeutic communication that I provided was an intervention that was centered around the patient's specific need at that time, which was emotional support.
Tell me how you use something you learned from one of your assignments to incorporate best practice and professional values and standards into compassionate nursing practice.
In one of my clinical experiences, I was assigned a client who would frequently pull off her high flow oxygen, which would make her desaturate, and she would become very agitated whenever a nurse went into the room to put it back into her nose. Some of the concepts that I remembered from our first semester of nursing school was the importance of autonomy, as well as educating a client on what you're going to do before you just start doing it. So whenever I would go into her room, I would make sure to reintroduce myself, and I would explain to her why it was important for her to keep her oxygen on. And before just sticking it back into her nose, I would ask her permission first. Is it okay if I put this back on you? This gave the client some autonomy and control back in her health, and it made her less reluctant to refuse the necessary treatment.
Did the outcome of using this new knowledge improve the situation you used it for? Why or why not?
Using this knowledge did improve the outcome of the situation because in the end, the client was removing her oxygen less often. And if she would remove it, she was more pleasant and cooperative whenever I or another staff member went into the room to reapply her oxygen.
Tell me an example of how you have improved cultural and global congruency within the healthcare environment with diverse populations in promotion of a healthy lifestyle and preventative health screenings and clinicals at Fayetteville Technical Community College.
During my clinical rotation on the oncology unit, I cared for a client who was newly diagnosed with lung cancer during that admission. She was an older Hispanic client who was very adamant on her son being present whenever any new information was presented to her. So this made me aware that in her culture and in her family, it's very important for a male figure to be present and involved in decision making. So I made sure to not only address the client, but to involve her son in any type of education I was providing, as well as whenever I entered the room to inform her what I was going to be doing, I let the son know as well. They ended up voicing understanding in everything I told them, as well as appreciation at the end of my shift, and he thanked me for taking care of his mom.
How does incorporating this impact how and what you present in discharge information and education?
When it came to discharge teaching, I made sure to print out a copy of the instructions for the patient and the son as well so they could both follow along with me as I explained to them what was in the paperwork. I also made sure to print out a copy that was in Spanish just in case when they got home there was any confusion with something that I went over, they didn't understand something that was in the printout, and just so they could have an extra resource with the information that I provided them.
Describe a situation at SIM or in clinical where you functioned as an effective member of the healthcare team, demonstrating excellent interprofessional collaboration.
Last semester, I took care of a client on the step-down unit who was febrile and tachycardic despite receiving Tylenol around the clock as well as IV fluids. I mentioned to the nurse that the client may benefit from possibly receiving ibuprofen along with his Tylenol, just alternating them since the Tylenol alone was not breaking his fever. The nurse thought that it was a good idea, and she gave me the opportunity to present this idea to the provider as well, who ultimately agreed. So this is what we started doing for the client, and at the end of my shift, he was no longer febrile and his heart rate had improved as well.
What skills have you learned in classes at Fayetteville Technical Community College that have increased your communication skills?
I used the SBAR communication tool that we learned in class to present this idea to the provider. Using this tool made me a lot more comfortable and confident in relaying this information as a student nurse when addressing a doctor.
Can you describe how you have demonstrated beginning skills in point of care leadership, management, and care coordination using effective communication skills, either through successful completion of class projects or clinical experience?
In my leadership class, we were assigned a group project to identify a gap in service for a specific population and to address that topic by creating a public service announcement as well as a flyer that would be posted in a public location in the community. I volunteered to take on the responsibility of reaching out to the community resource, and I was able to coordinate a meeting between my group and that point of contact. We were able to take a group photo, which was a requirement for our project, as well as post our location in that community setting so the information and knowledge could reach that population that we selected.
How do you plan to grow and strengthen your leadership skills in your practice as a nurse?
I plan to grow and strengthen my leadership skills in my practice as a nurse by staying up to date on the policies and procedures in my assigned unit and getting involved with any evidence-based practice projects that we have in order to be able to serve as a resource to my coworkers. My goal is to become a preceptor as well as a charge nurse on the unit that I work on.
Can you describe to me how you implement safe and competent care to individuals through both system effectiveness and individual performance in varied healthcare settings?
I implement safe and competent care to individuals by ensuring that I follow the 5 rights of medication administration, which each med pass that I complete. I use system effectiveness by acknowledging and reading the safety alerts that appear in the EMR, as well as using barcode scanning when I'm doing my medication passes. I use individual performance by making sure to look up and review any medications that I'm unfamiliar with before administering them to the client.
Tell me about a specific clinical situation in which you identified an unsafe environment for the patient and what you did then. Would you change what you did then? If so, why or why not?
During my first semester of nursing school, I was assigned clinicals on the inpatient rehab floor. As I was leaving my assigned client room, I heard a bed alarm going off across the hall, and it's everyone's responsibility to respond to bed alarms. So I went into that client's room and found them trying to get out of bed without assistance. The client stated that they were fine, they didn't need any help, and they were just walking to the bathroom. But I figured if the bed alarm was on, it was on for a reason. So I stayed with the client and helped them ambulate to the bathroom. Looking back on it, I wouldn't change anything that I did because as we were walking back, the client was very unsteady on their feet and they became dizzy. And if I wasn't there, then the client could have potentially had a fall or any other injury during that time.